Today I'm going to explain how lovastatin, also known as Mevacor, lowers cholesterol. I'll first start off as to why it's an important drug and then go into one step of cholesterol biosynthesis that controls the speed of the whole pathway, and then finally connect the biochemistry to what lovastatin does in the body and what patients actually experience. So LDL cholesterol matters because it delivers cholesterol from the liver to the tissues. When there's too much LDL in the blood, cholesterol can actually accumulate in the arteries and form plaque, raising the risk of heart attack and having a stroke. A powerful way to reduce LDL is to make the liver display more LDL receptors, because those receptors pull LDL particles out of the bloodstream. The trick with that is that the liver increases LDL receptors when its own internal cholesterol level goes down, and then statins exploit on the built-in system. Here's the short version of the cholesterol biosynthesis. The pathway starts with acetyl-CoA in the liver. Several quick steps combine acetyl-CoA molecules into the HMG-CoA. Then comes the slow rate-limiting step, an enzyme called HMG-CoA reductase that uses NADPH to convert HMG-CoA into mevalonate. After that, the pathway expands into a series of isoprenoid building blocks that assemble into squalane, cyclize into lanosterol, and are processed into cholesterol. If we turn down HMG-CoA reductase, the entire downstream pathway, doesn't work, and then the liver's cholesterol pool shrinks, and the LDL receptors go up. Or it doesn't mean that it doesn't work. It quiets down the liver cholesterol, and the pool shrinks, and then the LDL receptors go up. So that brings us to lovastatin. In the tablet form, lovastatin is mostly in a closed ring lactone form. That lactone is a prodrug, which means it's not the most active version yet. After you take it, esterases in the body open the lactone ring to form a beta hydroxy acid. This open acid form is the active drug. It matters because the shape and the chemistry of the acid closely resembles the high energy intermediate that HMG-CoA reductase forms during its normal reaction. And because of that, the active lovastatin acid fits into the enzyme's active site and then blocks it. So basically, the drug occupies where the position of the real substrate needs. So mevalonate production falls. Mevalonate production falls. Once the enzyme is inhibited and hepatic cholesterol synthesis drops, the liver responds through a transcription program called SREBT. SREBT activation increases the number of LDL receptors on hepatocyte surfaces. More receptors means faster clearance of LDL particles from the blood. That is the central reason statins lower LDL. The benefit you see on the lipid panel is not just less production, but also more removal. So what kind of effect should you expect from this drug? With typical dosing, lovastatin lowers LDL by roughly 20 to 40% depending on the dose and on the person. Triglycerides usually fall modestly, and HDL cholesterol rises a little. Results begin to show within 2 weeks and approach their maximum by about 4 to 6 weeks. In this timeline, it's useful to set expectations for follow-up labs. So lovastatin is usually taken within every evening meal because the liver synthesizes more cholesterol at night. The drug undergoes significant first-pass extraction by the liver, which is actually helpful since the liver is a target organ. Lovastatin is metabolized by CYP3A4. So strong CYP3A4 inhibitors and grapefruit juice can raise its concentration and increase the risk of side effects. When counseling patients, it's worth asking about interacting medications and advising them to avoid grapefruit products. Most people tolerate lovastatin well. The common complaints are mild muscle aches or stiffness and occasional small elevations in liver enzymes. Serious muscle injury is rare but important. Patients should report new, unexplained muscle pain, weakness, and dark urine. Lovastatin should not be used during pregnancy or breastfeeding, and it is avoided in active liver disease. These cautions help balance clear cardiovascular benefits against uncommon risks. So here's some key takeaway points. First, cholesterol biosynthesis has one main choke point, the HMG-CoA reductase step. Second, lovastatin is a lactone prodrug that is hydrolyzed in vivo to a beta hydroxy acid. The active acid is the form that binds the enzyme and competitively inhibits it. So also, the biological consequence of inhibition is a decrease in hepatic cholesterol and an increase in LDL receptors, which together produce a clinically meaningful reduction in plasma LDL. And then when it's used appropriately and monitored thoughtfully, lovastatin turns a single well-chosen biochemical target into a reduction in cardiovascular risk. Thank you.